Whilst dolphins technically can't access the NDIS, it's believed they've profited via dolphin therapy provision. Allow me to introduce you to the NDIS sphere. It goes like this. We didn't know what had been done, who did what, or what it cost in part or whole. We didn't know to whom, for how many, what needed doing, or how much hadn't been done before. Nobody knew what everyone knew. Someone had to know what they were doing. So many didn't know that nobody knew. Who did know to ask who knew. We didn't know, and no one wanted to say it out loud. Hello, I'm Claire Louise McCracken and welcome to my podcast, The Butterfly Effect. If, like me, you've been enduring this world and thinking to yourself, sod this for a game of soldiers, then you are in the right place. Here we discuss a range of issues that affect everyday people and everyday lives. We discuss issues that touch on disability and the NDIS, aged care, healthcare, social care, and the sheer frustrations of the world we now live in. Every person and every voice, including yours, has the power to create seismic change. If you are interested in a no-nonsense approach to the issues that face all of us, welcome. Please like and subscribe. That simple act can become the powerful force where we the few will become we the many, no matter who or where you are. In the beginning, the states and territories looked after people with disability, and unobserved, all was well until it wasn't, which was when it was observed. It wasn't exactly well, but it was familiar. We had institutions, we closed them, telethons, we held them, and the soothing carbohydrates of national goodwill, including at various points a surprising number of sponsored finger buns. Then we discovered a very Australian truth. You can spend an extraordinary amount of money and still end up with a system where outcomes look like a mirage, and the mirage charges a booking fee. So we invented a new universe. We called it the NDIS. It was, we were assured, the best idea, the bestest. The sort of idea you can't oppose without being accused of personally stealing someone's wheelchair whilst they're still in it. And to be fair, the promise was magnificent, practical, humane and safe, real support, families confident their loved ones would be cared for long after they were gone. Then the NDIS did what it does best, expand, mutate, and develop entirely new organs. And we did what humans do best. We acted surprised. Douglas Adams warned us, a common mistake is to underestimate the ingenuity of complete fools. The complete fools here aren't participants or families. They're the people who thought a high-risk care system could run on slogans, ambiguity, and vibes. Reform is here, cue the panic, and the brochures, in a bid to prevent abuse, exploitation, and neglect. And yes, those harms are real and unacceptable. The Commonwealth has produced the National Disability Insurance Scheme Amendment, Integrity and Safeguarding Bill 2025. It expands the compliance and enforcement toolkit of the NDIS Quality and Safeguards Commission, increases penalties, strengthens banning and compliance powers, tightens information gathering and introduces operational changes for the NDIA, including a 90-day cooling off period for withdrawal, a move to electronic claiming and clarified plan variation powers. It looks tough. It reads tough. It will photograph very well. And that is the problem, because the NDIS is increasingly seeking only to safeguard itself. Not participants, not workers, not families. The scheme, a penalty schedule, is a wonderfully convenient form of safeguarding for a bureaucracy. Cite the fines, wave them around like a talisman and say, we did that. without doing anything that would actually make a participant safer at 2 a.m. It's an institutional protective charm, fine-shaped and headline-ready. The problem with Fine First reform is let's keep it simple, sweetheart. Fines don't create competence. Competence safeguards people. If you want fewer preventable deaths, fewer hospital admissions, fewer unserviceable participants, and fewer workers being physically and psychologically broken, you don't start with maximum penalties and hope safeguarding will magically appear. You start with basics. Trained staff, stable staff, staff who can read the days of the week on a Webster pack, mandatory handover of critical information, clear, uniform standards so breaches aren't subjective, a system less complex than a tax return written by Kafka, and real accountability for everyone, including the NDIA and the scheme itself, because too much regulation and the wrong regulation isn't safeguarding, it's administrative cosplay. The reform we keep avoiding, a national support worker registry. If we wanted the single most effective safeguard, we wouldn't be arguing about how big a corporate penalty should be. We'd build a national support worker registry, not provider registration on paper, worker registration where it counts. The front line, where risk is detected, crises are prevented and care is either safe or it isn't. A national registry would lift baseline competence across the workforce, allow swift exclusion of unsafe workers across the sector, not just within one provider, protect small boutique providers by shifting safeguarding to workforce standards, not corporate compliance theatre, and give participants a simple way to verify who is in their home. But a registry without training is just a list. It must sit beside a fit-for-purpose qualification and certification pathway, tiered, practical and enforceable. Human rights and safeguarding plus clinical literacy, medication awareness, infection control, pressure injury prevention, escalation, supported decision-making and capacity literacy and basic risk management. You cannot build safeguarding on churn. Participants don't want a revolving door of strangers. Workers don't want to be dropped into dangerous situations without supervision. Families don't want to spend their lives retraining new faces. Staff conditions determine who we keep. And continuity isn't a nice to have, it's safety. The simplest thing of all, run human rights with a medical model. Here's the part that should be so obvious it's embarrassing. The NDIS still refuses to properly integrate medical and clinical reality. We've built a scheme to support disability, then behave as if acknowledging medical needs is ideological treason. It's nonsense. Disability isn't purely medical, but it is inseparable from medical realities. Swallowing risk, diabetes, seizures, wounds, infection control, medication management, mental illness, cognitive impairment, fluctuating capacity. Human rights are essential, but human rights without a medical model isn't progressive, it's negligent. And many participants do not have the capacity to exercise choice and control the way policy fantasises about. That lack of capacity often embodies the very reason they're on the NDIS in the first place. It's crazy, huh? The information blackout. Now we reach the hitchhiker phase where you start to suspect you're trapped in an expensive cosmic joke. Participants are told they don't have to disclose information, disability, plan risks, even whether funding remains. The NDIA may hold the history, the flags, the funding status, and still not tell the provider. That is, of course, if it knows what it needs to know in the first place. The provider is expected to deliver safe care. Then something goes wrong. The provider is fined and penalised for not knowing what they were not told in a system designed to keep them from knowing. Let's make it plain. A participant has dysphagia, an aspiration risk, but doesn't disclose it or can't, or there's a transmissible, legally reportable infection. Nobody tells the provider about it. Or a violent history, diabetes, a severe allergy, guardianship orders, known impaired capacity. The provider asks for information to staff appropriately and mitigate risk. The system says privacy, choice and control, and assorted ideological confetti. Then harm occurs. Then the Commission protects itself by fining the provider because someone must be responsible, and it certainly won't be them, that it withheld the facts. That isn't integrity, it's self-protection. And fines don't fix lives, they don't restore health, they don't undo preventable comorbidities, they don't bring back workers who've left after being injured, traumatised or blamed. When safety is in question, a deadline isn't a welfare response. The bill strengthens information gathering powers and timeframes. Fine. Sometimes speed matters. But if the system is genuinely concerned about a participant's safety, it is insufficient to simply request information within a set period. There must be a welfare check, a real world response that cites the participant and ensures they are safe. Paperwork has never performed CPR. The same logic applies to withdrawal. A 90-day cooling off period may prevent coercion on paper, but where a participant is high risk, there should be a face-to-face exit interview or equivalent in-person safeguarding step to ensure there is no coercion and to ensure a provider isn't withdrawing someone to protect themselves. Leaving the participant stranded, you can't ensure ideology. Huge fines may deter bad actors. They will also deter good providers from taking complex participants because insurers don't price morality, they price risk. If penalty exposure rises while the system remains fragmented, underskilled and information-starved, insurance rises. Providers exit, and the people most affected are those deemed high risk. Whether that risk is real or merely perceived, that's how the most vulnerable become the least supportable. We already have laws and criminal charges for serious negligence and wrongdoing. What we lack is a consistent, competent baseline that makes breaches objective rather than subjective. Without that, fear will take over. And fear is not safeguarding. An unregistered provider, an ABN and a dream. There is another farce here. The scheme tries to regulate a market as if it's meaningfully regulated. It isn't. A significant chunk of care is still delivered outside registration, often with fewer enforceable requirements than any other high-risk sector would tolerate. It's like going to a doctor who isn't qualified but points to an aspiration on the wall. Don't worry, I'll try to do no harm. In healthcare, we don't pretend a good attitude replaces competence. Yet in disability, we keep trying to make it true and then act astonished when preventable harm follows. Stop letting the NDIS be a side hustle. Now to the part where our legislation develops that distinct flavour of naivety that overseas bad actors have enjoyed for years. We must look at who owns these companies. We shouldn't allow intimate high-risk disability care to be treated as a low-barrier hustle, including business models where the controlling person isn't even in the country. This isn't a crack at migrants or students as people. Many are hardworking and capable and are thrown into a system that sets them up to fail. This is a crack at policy settings that allow offshore control, weak accountability and enforcement fantasies, because no fines can be paid if the director isn't here, no assets here, no governance here, no enforcement here. Fat chance fining anyone who can't be found. If Canberra wants integrity, it needs enforceable onshore governance, beneficial ownership, transparency, residency, requirements for controlling persons, and the end of invisible directors enjoying Australian taxpayer money from a safe distance. Mandatory handover isn't red tape. It's the foundation of risk management. Providers must know the facts to provide informed care. Medical history, behaviours of concern, swallowing risk, medication risk, discharge instructions, guardianship orders, triggers, escalation plans. This matters in group settings too, where unmanaged risk can put multiple participants and staff in unsafe situations. Staff safety is participant safety. Withhold information and you don't get safeguarding. You get predictable incidents. We're still asking the wrong question, and the answer isn't 42. Canberra is in turmoil. There's head-scratching, task forces, reviews, reshuffles, and more reform than anyone can keep up with. At times, it feels like another Adams line applies. It would save a lot of time if we all just went mad now. There's also the other hitchhiker rule. Once you understand the universe, it gets replaced by something even more bizarre. The NDIS seems to do that in real time. Every time we examine it, it becomes more complex, more expensive, and more detached from the basic realities of care. The fix isn't glamorous. It's simple. Professionalise and stabilise the workforce. Build a national support worker registry and real training. Run a human rights model with a medical model. Mandate lawful handover. Do welfare checks and face-to-face exits when risk is high. Make the NDIA and the scheme accountable and ensure onshore ownership and enforceable governance. It is about time that Canberra started asking the right questions. Here's the thing. We know what the problem is and the rest of the country can see it plainly. The system is the problem, and it's the system that is failing and failing to be accountable. The country doesn't need another Vogon soliloquy or Quango-layered bureaucracy dressed up as reform, or any more interjections from enthusiastic pseudo-professionals who live in a different universe, the Canberra bubble. We need practical, simple solutions grounded in reality, the real world where the rest of us live, and that's actually great news for us mere humans. And for those of us for whom the NDIS literally means their life, their universe, and their everything. Well, that's me for today. Thank you so much for listening. I encourage you to contribute to the discussion, and I always reply to as many people as I possibly can. If you'd like to contact me, please do so on 1800 422 228 or email at claire@candor.group. I'm also on Facebook at Carers and Advocates and Instagram at Carers and Advocates, or you can check out our website at www.carersandadvocates.com. You can also find me on LinkedIn. If you feel you have a story to expose, please feel free to contact me. Remember, it takes every single drop to make an ocean, so please drop a little like and subscribe. It may well be that our individual actions are small, but when we are brave enough to stand apart from the madness, and we can become a force together. We are all in this together.
It's where it all started.